Hello and welcome. My name is Zara and I'm a member of Group 3 of the Unit Vascular Sonography. This video was created to inform you of the mnemonic ISBAR, which is widely used in a healthcare setting. ISBAR is an acronym for Identify, Situation, Background, Assessment and Recommendation. It was created to improve the safe transfer of information among healthcare professionals. ISBAR will be identified and elaborated on later in this video. I hope you enjoy watching this and learn from the important information conveyed in this video.
An important aspect of ISBAR is the initial communication between the patient and the sonographer. During the patient's examination, the sonographer will get all their identification details such as name, date of birth, gender, signs and symptoms, relevant family history and why they have been referred for the scan. The sonographer will then explain the examination and perform the scan whilst gathering required information and images for the radiologist. With the assessment complete, they can conclude the recommendations which will then complete the ISBAR technique. The sonographer can now confidently transfer all important patient and clinical information to the radiologist, ensuring nothing has been missed. I is for identify. Here the sonographer is to transfer all relevant patient information to the radiologist so they can identify specific factors such as gender and age.
Hi Dr. Goodwin, I have Mary Smith in my ultrasound room. She's a 60-year-old Caucasian female who has a history of heavy smoking and has previously had a cardiac arrest at age 55. Would you mind if I spoke to you a bit about her ultrasound today?
Yeah. The situation is then discussed with the radiologist so they know exactly the examination which has been requested and performed, as well as what part of the body was and was not examined.
So did you perform a complete upper abdomen ultrasound today, or did you just perform a targeted aortic ultrasound?
Yeah, Mary's referring doctor just ordered a targeted aortic ultrasound, so that's all I've completed.
Okay, that's fine, thank you.
Obtaining background information on the patient is important to pass on to the radiologist, which includes the relevant personal and family history.
So did you manage to get any type of history from Mary, family histories, and why she's into the exam today?
Yeah, so her doctor seems to think that her father passed away suddenly from a AAA, however they are unsure.
Okay.
She has no previous, she has no other family history or anything of a AAA.
Yep.
And she had a cardiac arrest at age 55, so 5 years ago.
Yep.
She did have some imaging studies completed on her heart, however nothing on her abdomen, so we are unable to compare anything from there.
Yep.
And she has been experiencing these palpitations for 2 years.
Yep.
Last couple of months though they have been getting increasingly worse for her. She hasn't been seeking medical attention due to the fact that she lives in a remote location.
Okay, yeah.
Now an assessment can be made of the findings. Here the sonographer's recommendations on what the provisional and differential diagnosis is and how they came to that conclusion is told to the radiologist for their opinion.
So when I was performing the examination, I did come across a AAA. What I found was a 4.5 centimetre fusiform AAA. It was infrarenal and did not involve the renal arteries, and it was 1 centimetre above the bifurcation. The patient was quite gassy, but I am pretty certain that it was a true aneurysm and not a false aneurysm, as it did involve all 3 layers of the aortic wall. I have sent through the images on the PAC system. Would you mind if you take a look at them for me?
Yeah, I'll do that now.
With the identification, situation, background information and assessment and the sonographer's recommendations now being told to the radiologist, they can now make their informed decisions on what the next step is for the patient and send a report to the referring practitioner.
So comparing the images that you took and the patient's symptoms of the palpitations and pain, I am going to confirm that the Mary does have a AAA. It is definitely fusiform, and I will say that it is a true aneurysm as it does involve all 3 layers of the aortic wall. From here, I would just get you to go and talk to your patient. You need to inform her that she does have an abdominal aortic aneurysm. We will be in contact with her doctor and I will get the report to her doctor immediately.
After watching this video, you should now be able to understand how ISBAR works and be able to use it in a clinical setting. Thank you for watching.